Hello, and thank you all for joining us for today's webinar, Controlling What You Can, the latest in an ongoing webinar series designed to support first responders' mental health and well-being. It goes without saying that these are challenging times for all of us right now. COVID-19 has wreaked havoc on our lives. Worldwide, there are more than 3.8 million cases and more than 264,000 deaths. As of now, there is no definitive treatment to fight this disease, and we still have yet to figure out how to scale testing and monitoring. But most sobering are the battles you all are waging on the front lines, day in and day out. We see your brave faces on TV and social media, looking overworked, exhausted, and overwhelmed. About 2 months ago, as we all realize the unprecedented challenges taking place in our lives, the Harvard T.H. Chan School of Public Health, Thrive Global, and CAA Foundation announced the launch of First Responders First. From the start, our mission has been to provide you with the health and safety resources you need on both the physical and the psychological fronts. It was most important for us to create a program that represents the whole human approach. A holistic approach that is committed to helping you, our frontline workers, build resilience during a time of tremendous stress. It was clear when listening to people on the front lines and taking in the data, we had to address the needs of our first responders, and that the needs went far beyond providing protective equipment. Reliable childcare, for example, we learned was a major concern. When you are putting in these long hours, exhausting shifts, the last thing you want to be concerned about is arranging reliable childcare. Then there's housing. We learned that so many of you were sleeping in your cars for fear of infecting your families, while others of you were simply too exhausted from long shifts to drive home. And nutrition. We understood that first responders could not take the best care of others when they were lacking the basic nutritious meals and nutrients in their diets. So, first responders first, we designed so that we could work for you. And we worked for you by implementing a number of partnerships. We call them implementation partners that would allow us to provide services to ease the concerns you all have. For example, implementation partners included Bright Horizons, Marriott, and World Central Kitchen. And these partners helped us help you address your needs. And as I mentioned earlier, our other crucial component to our efforts for first responders first involved our paying attention to the mental health aspects, the mental health and emotional strains that you all are facing. We understood early on that it was our public health imperative to make your mental well-being our highest priority. Why? Because you are our workforce, and you are a workforce under enormous stress and strain, even during normal times. And the additional stressors that you now face during this COVID pandemic was simply put an unsustainable level of stress. Tragically, we've already witnessed the toll of this exceptional burden has taken on each of you. We have seen recent suicides of the ER doctor Lorna Breen and the EMT John Mondello. So we at First Responders First have simultaneously launched a collection of resources for healthcare workers in order to give you access to online workshops, virtual training, coaching, and content through micro steps that focus on your sleep health, movement, nutrition, stress management, and relationships with your colleagues. We have also been collaborating with a broad swath of regional and national organizations to help amplify our message and work to identify the ongoing and emerging needs of frontline workers. They represent a broad swath of sectors, from government to nonprofit to unions, so that we can better understand your full experiences, the strains and stress that you experience, and thus use that information to address your needs. In times of crisis, we understand that the tendency is to deprioritize your own well-being. We understand that you are trained, exceptionally qualified clinicians and healthcare providers, and that your training has taught you and even encouraged you to dismiss any sort of healthcare as frivolous or selfish. But my message to you is this: self-care will save your life. Self-care saves lives. You must take care of yourselves in order to take care of others. As the saying goes, you must put your oxygen mask on first before you can help others. Our goal with First Responders First is to remove any and all stigma and dismantle old paradigms around self-care in order to help you, our indispensable frontline workers, prioritize your own health and well-being. Thank you for all that you do.